Every summer across India's coastal belt, hospitals quietly fill up with cardiac patients. The days feel relatively normal, maybe a bit sticky, but nothing that commands a severe weather warning. The trigger for these emergencies is rarely a massive temperature spike. It is the invisible weight of humidity pushing the cardiovascular system toward its absolute limits, often without the patient ever feeling an obvious alarm. The data shows a massive blind spot in how we view the weather. The U.S. Environmental Protection Agency confirms that roughly 25% of all heat-related deaths are actually cardiovascular events. We are conditioned to look for scorching thermometers, but days with moderate heat and high moisture create a uniquely punishing environment for human biology. The heavy air actively disables the body's primary cooling mechanism, forcing the heart into a high-speed stress test while you are standing completely still. When you get hot, your body releases sweat, but the actual cooling only happens when that moisture successfully evaporates off your skin, carrying the heat away into the surrounding air. This diagram shows the mechanics of high humidity. The air is already so saturated with water that it forms a barrier against your skin. Your sweat has nowhere to go, trapping the heat inside and causing your core temperature to climb rapidly. Sensing the trapped heat, your brain initiates an emergency backup plan called vasodilation. It quickly widens the blood vessels right beneath your skin, trying to dump the excess heat out through direct radiation. Opening up all those surface vessels creates an immediate plumbing crisis. A massive volume of blood pools near the skin, meaning less blood flows back to the center of your body, causing your overall blood pressure to plummet. The brain's attempt to lower the temperature creates a severe pressure deficit. To keep oxygen flowing to your vital organs, a heart has to solve the problem through sheer mechanical force. While your pressure drops, you are still sweating heavily. Leaking that fluid, along with essential sodium and potassium, causes the blood itself to physically thicken. Pumping this sludgy blood raises the risk of dangerous clots. At the same time, the draining electrolytes disrupt the electrical signals that keep your heart beating in a steady, predictable rhythm. This chart shows the heart's extreme overcompensation. To maintain circulation with low pressure and thick blood, the heart must pump 2 to 4 times more blood per minute than on a cool day. Researchers at Harvard Medical School have tracked this massive surge in cardiac output, confirming that a humid environment directly weaponizes the cardiovascular system against itself. For millions of patients, their daily prescriptions become a liability. Beta blockers stop the heart from speeding up enough to cool the body, while diuretics accelerate the dangerous fluid loss. Combine thick blood, dropping pressure, and medication interference, and a pre-existing heart condition quickly escalates into a biological system failure. To navigate this risk, the standard thermometer is useless. You have to monitor the wet bulb temperature, a metric that combines heat and humidity to show your body's actual cooling capacity. When the wet bulb temperature reaches 32 to 35 degrees Celsius, even a young, perfectly healthy body entirely loses the ability to shed heat. The danger frequently compounds when the sun goes down. If nighttime temperatures stay above 24 degrees Celsius, the heart never gets a chance to recover from the daytime stress, doubling the cumulative risk. These sustained wet bulb events are already the standard reality during the peak summer and monsoon transitions across regions like Kerala, Mumbai, and West Bengal. Humid heat is an active medical condition. Once it crosses those specific thresholds, the environment you walk into becomes your primary cardiac risk factor. This heat action plan outlines the core defense strategy. Monitor your resting heart rate and seek shelter if it crosses 100 beats per minute. Use air conditioning or dehumidifiers to lower indoor moisture, and consult your cardiologist to adjust your medications for the season. For patients needing dedicated support, centers like Nessin Health offer non-invasive, integrated cardiac therapies designed specifically to manage these exact environmental risks without surgery. Respect the physical weight of humidity. When the air gets heavy, do not leave your